Hi everyone, welcome back to my channel. Today I am here to talk about tips to improving fertility. As we've discussed before, infertility is the inability of couples to achieve pregnancy after 1 year of unprotected adequate sexual intercourse. It's a global problem and it affects about 12 to 15% of couples. It's a distress both to the couples involved and even to the gynecologist managing them. And that's why we're going to talk about the tips that will help improve fertility. Amongst these tips are practices like sexual practices. There are some sexual practices that is done that does not support fertility positively. Now, another is diet. There are some food that is taken that affects fertility negatively. The third is body mass index. That is the weight of whoever that is involved, whether the person is underweight, obese, or normal weight. The third is exercises. Exercises are good to keep the body fit, but there are some that are not good for those planning to get pregnant. Others are caffeine intake, alcohol intake, illicit drugs and antibiotics, the type of clothing that the person wears, and even occupation that the person does, and also the type of food or lubricants that the person uses. Before we go on, please, if you have not subscribed to my YouTube channel, subscribe to my YouTube channel at Dr. Nkiruka Bridget, OBGYN Talks with Dr. Ada Zion. Follow my Facebook page at OBGYN Talks with Ada Zion. I'm also on TikTok with the same name. I'm also on Instagram at Nkiruka Bridget. So thank you, subscribe, for following me and for subscribing. Let's go on. There are some sexual practices that does not support fertility. Now, a woman has a cycle that ranges between 21 days to 35 days, an average of 28 to 30 day cycle. Now, at that in between the cycle, it's expected that a woman ovulates 14 days before her next menses. This may not be calculated adequately by the people involved, except if you calculate it retrospectively, going backward after your menses. It will help you to find out when you ovulate. Now, some couples don't have sexual intercourse just 1 or 2 times a week. It does not help. When a woman comes to infertility clinic, we advise that you have adequate sexual intercourse at least 4 times in a week, interspersed within the week. Now, for people that we are following closely, the people that are being monitored, we expect that you have your sexual intercourse around your ovulatory period. That is the time that you are at peak of getting pregnant, and is assumed to be between 12th day of your cycle to 18th day of your cycle, especially for those that have 28 to 30 day cycle. Now, at that time, how will you know that you are ovulating? Number 1, you can use strips. There are some strips that have been developed, ovulation kits, that will help you to note when you ovulate. They come with 2 lines. Some come with a smiling face on that strip. It picks some hormone like luteinizing hormone, estrogen. It shows that these are high. So at that period before ovulation and even to ovulation time, those peaks will pick that you are ovulating. So if you have that strips, it's important to use them to find out the time you are ovulating. Now, some women can also use the cervical mucus that comes out of their body. At the time of ovulation, it tends to draw. The hormones in the body help them to be slimy and transparent. But after ovulation, you will see them, they become thick. That is the effect of progesterone on that cervical mucus. At that time that they are slimy, it helps sperm penetration to the fallopian tube to help fertilize the eggs that are picked. So if you miss that period, or if you always miss that period, it is not good. Even the body itself, nature has made it so much that at that time of your ovulation, you tend to have high libido. So maximize it to get what you want. Now, you can use basal temperature. This is not trusted because most time before that 0.5% increase is peaked, you've already passed ovulation. What happens in high basal temperature? Your temperature becomes a little bit high by 0.5 degrees centigrade, and what happens is that it is the effect of progesterone on the body that helps your body, that helps you to have that exchange in your temperature. Now, some other practices that people do. You know, some men will come that their women are dry and they want to use saliva, they want to use olive oil, they want to use KY jelly. These gels and some others have been found to be deleterious. They desensitize or kill sperm and may not allow the sperm to migrate and go to where they are supposed to go. Sleeping position has not been seen to help, except for those that have retroverted uterus. Those that have retroverted uterus, we advise them to use either doggy. It helps a lot. Now let's go on. If you are using lubricants, if you must use lubricant because of vaginal dryness, please try and use things like canola oil, baby oil, things that are not harsh on sperm. But if not, we advise don't use anything. Don't use any lubricant. Don't use any KY jelly. Don't use any olive oil. Don't use your saliva. They kill and desensitize the sperm that should do the work. Now we'll go on to diet. Most women, when they are looking for babies, they tend to overeat. It is advised that you eat plant-based food. Plant-based foods are better than animal-based food. If you're going to use animal-based food, please use lean meat. Lean meat are better than whole-fat meat. Please use plant-based food. Corn, maize, grain, these are good. Plant-based, just take it. Mediterranean foods are good. Seafood, foods that are natural, they are more better than artificial food. If you are going to use bread, use whole grain bread. These are important. It helps, you know, some of the artificial feeds affects the hormone of the body and may cause some changes, and the things that are supposed to happen may not happen the way it is, and the person will not get pregnant. So use plant-based food. Use food that are free of gluten, especially if you want to get pregnant. Now, let me go on. I wish I remember, if I remember other things about the food, diet, I will let you know. Artificial drinks that makes you to gain too much body weight, they are not good as you are planning to get pregnant. Now, let's go to body mass index. Body mass index, how do we get it? You get your weight in kg and you get your height in meter square. Divide it, use your weight in kg, divide by your height in meter square. If you get anything less than 18.5 kilogram per meter square, you are underweight. If you get anything that is 18.5, if you get anything between 18.5 and 24.9 kilograms per meter square, you are normal in weight. But if you get 25, anything from 25 kilograms per meter square to 29.9 kilograms per meter square, you are overweight. Anything above 30 kilograms per meter square, you are obese. And if you have anything above 35, you are morbidly obese. And there is extremely morbidly obese. Obesity is not good for whoever that wants to get pregnant. So try as much as possible to lose weight. Obesity is associated with some hormonal imbalance, polycystic ovarian disease. It's also associated with hyperprolactinemia. The fat cells will tend to be converted to some hormones that are not good and proper for you to be able to get pregnant. So if you are planning to get pregnant, try as much as possible to lose weight. Now, if you are so lean, underweight, it will be difficult for you to get pregnant because the nature has made it so much that your body tends to it doesn't want to support your body anymore. Your body is already on deficit and you want to add pregnancy to it, which will cause more deficits. So nature will not want you to kill yourself. That's why it will not allow you to get pregnant when you are underweight. That is that about body weight. Men also who are obese has been found out to have poor sperm quality. Sperms, their concentration are usually low. Sperm morphologies are abnormal. So if for a man that is overweight or obese, please let him try as much as possible to lose weight. It will help improve his sperm quality and improve fertility. Now let's go on. Exercise. Exercise is good for the body. It helps keep you fit. For anybody that is planning to get pregnant and you're obese, please try as much as possible to lose weight. If you lose at least 10% of your body weight, for someone that is obese, spontaneous pregnancy may just occur. But for someone that is underweight, please don't go and start doing exercises if you want to get pregnant, because it will not allow you, your body will not allow you to get pregnant. It will affect your fertility index. For someone that is overweight, for normal people that are normal, you are expected to maintain and continue to do normal exercises. But vigorous exercises is not allowed in your group. But for someone that is obese, vigorous exercises will help you. At least 30 minutes exercise weekly for 4 to 5 times per week, it's okay. It will help you to lose weight as much as possible, helps your hormone system, and helps your body in preparing for pregnancy. Now, I want to go back to food. There's one yam, in Africa, we've noted that there is high fecundity with increased twin gestation, especially in the Yoruba nation and also in the Igbo land. Now, it has been found out that our yam, the wild yam, contains some hormones, some things used in making fertility drugs. So those yam contain it and makes it possible for us for hyperovulation to occur. So wild yam has been associated with high fertility and even with phytoestrogen that helps in releasing luteinizing hormone, follicle stimulating hormone that causes ovulation. So local food, as much as possible, is better than refined food. And let's go back to caffeine and alcohol. Caffeine has been associated. Some studies have been done and found out that caffeine may affect fertility negatively. Also, other studies did not find anything, but it's expected that high caffeine should not be taken by someone that is trying to get pregnant. Alcohol should be avoided as much as possible because it causes low libido, causes even the men, the sperm will be desensitized. They will not be able to function appropriately. So if you are planning to get pregnant, reduce your intake of alcohol as much as possible. Reduce your intake of caffeine to normal range. Now, smoking is not allowed. Smoking affects the DNA of the sperm cell and even the egg cell and will cause someone that is about to get pregnant not to have high chances of getting pregnant. Illicit drugs like marijuana, cocaine, they affect the cells of the egg, the oocytes, and affect the vas deferens where the sperm passes through. So it may delay effect. It may cause inability of the sperm to work perfectly well. The egg may not work perfectly well. Then intake of some drugs helps. If you are coming from fertility, we advise you to take folic acid or food filled in folic acid. Living vegetable, they are very good. Eggs are important. Lean meats are good. You can even take folic acid tablets. They help in producing good egg that will be fertilized. So use of good folic acid is advised for at least 3 months before you get pregnant. It also prevents your baby from having some abnormality like neural tube defects, which will cause the baby to have either spinal bifida, some problem with the brains. So you take folic acid. Other things that I want to talk about is occupation. Some people work in factories that use chemical. Heavy metals like mercury can affect the fertility of someone. So if you're working in chemical industry, those that do welding, it could affect their fertility, their sperm production as well. Now, wearing of tight clothes. You see, it's said that the scrotum shouldn't be in a place that is high in temperature. That's why it's outside. That's inside is high. So that's why it's outside. If you're going to wear clothes, especially tightened clothes that will not allow proper circulation of heat around your scrotum, it may affect your fertility and cause decreased spermatogenesis. So please wear free clothes that will allow proper air circulation. If you're at home, please remove every panties that will tighten the scrotum or that area. It may affect your fertility. With these few points, I don't know if there's any other thing I'm missing, but if there's any other thing I'm missing in these tips, I will put it in my next video. Please, thank you for watching. I wish you the best of luck, that you're going to get pregnant soon. And I pray that you subscribe to this channel, share this page, follow my Facebook page for more tips. God bless you. Thank you.